Well, now, though, we're going to hear from the president and CEO of one of the largest healthcare systems in the U.S., Dennis Murphy from IU Health. Dennis leads IU Health and its 16 hospitals, over 400 clinical sites, and a growing number of home-based and telemedicine services. Well, today he's going to talk about what IU Health learned and how they're ensuring equitable healthcare delivery. Dennis, good morning.
Good morning, and thank you. It's a real honor to be a part of a BioCrossroads event. I always know that I will come away learning as I'm here. And today I really have two goals. One is to talk about some of the lessons broadly that we've learned during COVID over these past 18 months, and then more specifically, how that relates to diversity, equity, and inclusion. So I think beginning with the broad lessons, probably the first and most important thing is the importance of our team. And early on in the pandemic, we really focused on the notion of safety and what does that mean to our team. Some of that was physical safety. How do you actually provide the right equipment so that they could care for patients appropriately? But importantly, very early, we also learned that there was a lot going on in the world, and financial safety, the safety of their families, what it looked like at home was equally important. And so throughout the pandemic, we made sure we were communicating how we were addressing all of those issues. As we've gone through subsequent waves of the pandemic, you really see that emotional and behavioral health safety being an equally important aspect of what we need to get our teams to be healthy and ready to care for patients. And so that's been more complex, but I think equally important, and we know that's something that we're addressing every day. The next really important, I think, lesson we've learned during COVID has been just the baseline health of our state. We're seeing today that people have delayed care, so we've had over a 25% reduction in our emergency rooms of people showing up with heart attacks and strokes. And we know that hasn't gone away, that people are actually suffering. They're at home not getting the care they need. And so it's really created a really important imperative for us to say you can't wait for people to show up. You need to go out, you need to reach them where they are and be more proactive as we think about the ways we touch and seek out patients that we know are at risk. Finally, the last really broad lesson we've learned is how quickly we can innovate. That prior to COVID, we were seeing a couple hundred telemedicine visits every month. Now we average over 50,000 telemedicine visits every month. We also see that we've started up a hospital in a home program that at the peak of COVID, we saw over 100 patients in their home, which is actually about the size of a good-sized hospital that we were caring for in people's homes. Behavioral health has been transformed during COVID and really moving to that virtual platform for behavioral health. And we've also learned how to be adaptive in our facilities. So the pace of innovation is something we've learned and hopefully can sustain throughout COVID. So I think earlier, Dr. Lewis Hall talked about some of those healthcare disparities that we saw nationally. And I can still vividly recall in early April, about 30 days into the COVID outbreak here in Indiana, reading stories about healthcare disparities in New York and saying, we have to understand our data and we have to understand our patients. It was sort of a sentinel moment, I think, for everyone to say, oh my God, look how fast this is advancing. What are we doing? And I'm really grateful to say that our statistics for IU Health, we've actually seen better outcomes for our African American patients in terms of age-adjusted mortality versus white patients. And that was not the case in that first 30 days. But I think it also demonstrates that you can change. You can change the course of care and the behaviors you have. And I think a really important lesson for IU Health during COVID is going from these very broad health equity statistics to the very personal. Last December, there was a video that was put out by Dr. Susan Moore, who is an African-American patient at one of our facilities. In that video, she talked about the poor care she was receiving. And it was a sentinel call to us to actually evaluate what does it mean not to look at just the technical components of care, but actually the humanistic components of care. And what does that mean for each and every patient? And I would say coming out of that event, we have focused on three very broad things. One is trust. How do you build trust with communities and with individuals? How do you take meaningful action? And then how do you actually become accountable and really focus on accountability? And through that, I think we have tried to earn trust through action. We have committed to a whole series of very visible actions publicly, whether that's starting a new program at Crispus Attucks High School where we take a cohort of 33 students there, and we will take 33 each year during high school. We are training them to be either medical assistants or nursing assistants, and we are guaranteeing them an offer of a job when they graduate because we understand that to be better providers, we need a more representative workforce. And I said to the students as they were enrolling, I don't want them to be medical assistants, or I don't want them to be nursing assistants. I want them to be doctors. I want them to be PhDs. But I want them to engage in healthcare, that it's critically important. We've also engaged with local partners like the Center for Leadership Development, which I think is an incredible organization teaching life skills of what it means to be successful and what it takes to be successful. And we're grateful whether those students become healthcare workers or somewhere else in our economy. But that notion of visibly investing in the future is critically important. I think also within our four walls, we felt like we had to have a focus on the care we provide and knowing, are we really doing what it takes to provide equitable care? And so we've hired a chief equity officer. We're very fortunate that she was a health services researcher already at Indiana University. And Dr. Tucker Edmonds has already begun a critically important set of review of our care. And I would say the important lesson for us in that is that, again, when you look on broad-based statistics, our care looks equitable. But when you start to talk to individual patients with individual diseases, it either doesn't look that way or feel that way to them. And how are we going to change? The other part we also know is that data is about what happens when they're inside our four walls as a health system. And so much of what we're worried about is, are people even accessing care? So it's that call again to get outside our four walls and engage in the community, engage with patients where they live. And you can only do that through trust. And so we've actually spent a lot of time getting out in communities, talking about where we've fallen short, where we're trying to improve, and get the community's input on where we can do better. And I would say for myself as a leader, there's no forum I've been asked to that I don't try and attend, because I think it's important to engage directly as a leader. And then I think it's about accountability. So we have been very transparent throughout this on the findings of that external review committee. our accountability to actually make changes. We now have a very visible website that shows our representation numbers, our strategy, our progress on that strategy. And I think all of these are really critical lessons if we're going to make material differences in DE&I. And maybe just in closing, there are times where I think this is really difficult work, but critically important work. And I'm reminded around 2000, there was a document that was put out by the Institute of Medicine called To Err is Human. And it was really about the quality of care delivered in healthcare facilities. And now 20 years on, all of us in the healthcare delivery side understand the importance of making sure no harm is caused in our institutions. There are vibrant, active programs, and we have made material progress. And so I look at this past 18 months as sort of that same sentinel call that we know we have to do better. We know there are material ways you can do that, and now it is the persistent and consistent execution on that. But I'm excited because I actually believe that this has been a wake-up call, and there's also a road forward for us to be better. So thank you so much.
Dennis, thank you.